Today I'm joined by Tom Dee and Rory Price of Southern Vermont Healthcare, and we will be discussing the role of healthcare within Vermont's economy. Thank you both so much for joining me today.
Thank you, Sarah. Good to be here.
So when we talk about healthcare in Vermont, it's 17% of Vermont's overall economy. Can you put this data point into perspective for us?
Well, healthcare in Vermont, Sarah, is depending on what metric you use, is a first or second largest industry. And in many communities throughout the state, we are typically the largest employer. So it certainly has a very significant impact, and really the demand and the growth of healthcare will probably continue to grow, just given the fact that Vermont has the second oldest population in the country. So as people age, the demand continues to increase for healthcare. Mm-hmm. So it stands to reason that it will continue to be a very, very critical component of our state economy. As I said earlier, we are in this region, we're the largest employer. We employ over 1,400 people, so we're very significant. If you look at our operation is over $200 million a year, and it's just not the operations of the hospital; it's the multiplier effect that we as a major employer create in terms of the economy. And if you look at research, the research will say that the multiplier effects for major employers in healthcare are probably 4 to 5 times the size of their budget. So we have a very sizable impact.
And Roy, what is population health? Does this term mean?
That is a really good question. And so I think that term and others similar to it have kind of entered the public lexicon, particularly during the pandemic. And sometimes they're kind of used interchangeably. So we have population health, we have public health, we have community health. And it sounds like they're all talking about the same thing, which is keeping a large group of people healthy. But there are some differences in terminology that I think it's helpful for folks to know. So I always start with public health. So public health is working to assure the conditions in which people live, that they support a healthy life. So that can look like what Tom mentioned in terms of purchasing homes for kind of fixing up and resale so that individuals have a healthy home in which to live. So that's really looking at public health. Population health is really studying the health outcomes of a particular population and the distribution of outcomes within that population. Is sort of living in the future a little bit, and we're facing some of these demographic and other challenges that I think we'll start to see more prevalent across the nation soon. But that means that we're also at the forefront of creating solutions to those issues. And so I think, across the country, people are and will continue to look to Vermont as sort of a thought leader in terms of matters of payment reform and addressing the social determinants of health. So I think we're well situated to address the needs.